Are you seeking a solution for volume loss and skin sagging, but you're afraid of looking overdone? Well, you have come to the right place, because today I'm going to discuss hyaluronic acid fillers and how they can be subtly used to restore volume and that youthful radiance to your face. Stick around till the end of the video, because we're going to explore some real patient cases and I'm going to showcase my tailored approach to facial volumization. My name is Dr. Swati Cannon and I am a cosmetic dermatologist out here in California. And today's video is part 2 out of 3, all about fillers. Part 1 was about using natural filler called PRF or platelet-rich fibrin. Part 2 is about hyaluronic acid fillers, and stay tuned and subscribe for part 3, which will talk about biostimulatory fillers. When it comes to hyaluronic acid fillers, people either love it or hate it. I think the reason people don't like fillers is because they are used to seeing pictures of celebrities with their faces looking overdone. But this is not a problem with the product. This is a problem with the injector doing too many filler injections. Filler is one of the most common procedures done in the cosmetic industry. In fact, in 2019, about 2.7 million filler injections were performed, and this is based on a survey by the American Society of Plastic Surgeons. So to understand how fillers work, let's first briefly discuss how aging happens. We talk about anatomy often on my channel, and that's because we really need to understand the source of aging or what's happening with the aging process in order to find the right solution. As we've discussed in multiple videos, especially if you watched any of my videos in the past, aging is a multifactorial process. So in addition to collagen loss, elastin loss, and bone loss, you also have loss of the fat compartments within the face. So fat pads are compartments, and there are 2 layers. You have the superficial fat pads and the deep fat pads. When we are younger, these fat pads are really full, and it gives us that youthful kind of chubbiness and fullness to our face. When we go into our 30s, slowly these fat pads start shrinking. And initially we actually like this, because when the fat pads shrink, that fullness is taken away and it's replaced by a little bit more of that chiseling and definition of our bone structure. So you can see, Angelina Jolie, when she was 18, still beautiful, looks full. Angelina Jolie in her 30s is defined with these angular definition of her jawline and cheekbones. And that definition happens because of shrinkage of fat pads. But as we continue living our lives, these fat pads continue to shrink even more and then eventually start to sag as all of the other structures of our face also start to go down. So now, instead of having this triangular, youthful face, you now have a squarish or a lower triangular face as things start drooping and sagging. So what fillers do is that they fill these areas of volume loss and they fill this fat compartment. Filler is not the same as Botox, and often Botox and fillers are confused. Botox, which will be discussed in our 4th video, so stay tuned and subscribe. But Botox is a brand which refers to botulinum toxin, and botulinum toxin paralyzes muscles where we inject Botox into. And this mild paralysis causes softening of lines caused by muscle movement. Botox doesn't fill. Fillers fill, but fillers don't paralyze muscles. So those are 2 separate modalities of treatment. So when we use fillers, we're trying to fill these fat compartments, so rather the deep fat compartments most of the time, rarely the superficial fat compartments, so that we can change the vector from a downward sag to an upward triangular lift. We also can use fillers to smooth out certain lines, like the lines, your nasolabial folds here, the marionette lines, the corners of our mouth that create that frown as we get older. We can use filler to fill in very thin accordion lines that people often get on their cheeks from collagen loss. And so filler fills lines, filler fills fat compartments. While we use fillers to fill these deeper fat compartments to hopefully redrape tissues, fillers usually don't lift sagging tissues. And in the past, chasing this lifting ability of fillers is what led celebrities to look really overdone and made them have balloon faces. When we commonly think of filler, we're referring to hyaluronic acid filler, which is different than biostimulatory filler, which is then different also from natural filler. Hyaluronic acid fillers, usually they go by the names of Juvederm, Restylane, and these are basically different brands that make different types of fillers. There are a ton of hyaluronic acid fillers, which have their own specific characteristics, and we employ these different fillers to get the result that we want. What exactly is hyaluronic acid filler? So hyaluronic acid is a natural substance substance that's found within the dermis of our skin. And I have talked about it in my hyaluronic acid video, which was focusing on using hyaluronic acid in skincare, but the concept is the same. Hyaluronic acid in our dermis is a sugar molecule that can attract 1,000 times its weight in water. And when it does, it can help to plump the skin and retain moisture. Fillers like Juvederm and Restylane basically employ hyaluronic acid, then when injected, attracts water. So here's a simple demo of how hyaluronic acid fillers work. So this is Juvederm, which is a filler with really good water attraction capabilities. As you can see, it looks like jelly. Once the water hits it, the filler or the hyaluronic acid molecules start attracting all of the water, increasing in volume. And this is the basis of how filler works even when it's injected. Once it's injected, it will increase in volume by attracting water from surrounding tissues and keeping that water. This process, by the way, doesn't cause dehydration of the tissues. It actually, if anything, helps to hydrate the tissues because it holds on to the water and doesn't let it go underneath our skin. There are multiple kinds of hyaluronic acid fillers, each with their own specific characteristics. And we pick the filler based on where we want to inject, the patient's skin quality, the shape of the patient's face, as well as the outcome we want to obtain. So for example, if I have, somebody with a good round face and I want to give a little bit more definition by injecting filler onto the cheekbones, I'm going to choose a rigid filler that holds on to its shape to help create that definition. On the other hand, if I want to inject filler into the lips, I'm going to use a filler that is not very rigid, but is flexible and moves with movement because lips move a lot when we talk, eat, etc. So based on the desired outcome, the location of the injection is how we decide what type of filler. So if you are a patient and you come in and you say, I want Juvederm, I'm going to say, where do you want Juvederm? The better question is actually, what do you want Juvederm to do? Because then I can select the right filler for you. Where all can we inject hyaluronic acid filler? Pretty much anywhere in the face. We can inject it into the temples. Some people do forehead injections with filler. We can inject filler in the cheeks, in the chin, lips, nasolabial folds, marionette lines. So really, we can inject filler almost anywhere. And the advantage of using hyaluronic acid fillers is their flexibility and their reversibility. So that means that let's say I inject filler and you don't like the outcome. Well, I can dissolve the filler by injecting an enzyme called hyaluronidase, and this hyaluronidase pretty much within 2 weeks breaks down all of the filler. While, facial fillers are an effective tool for volumization, I really believe that less is more when it comes to hyaluronic acid fillers. So it is essential to use them in moderation. And it's essential to combine them with other procedures. So if you have sagging, I might recommend that you need a facelift or neck lift. And if you don't want that, well, then I might use a device that causes skin tightening and then use filler later on so that I can use less filler. I might combine hyaluronic acid fillers with biostimulatory fillers that my next video will be on, or with natural fillers like PRF, which I have mentioned in this video. Combination of treatments is very effective so that we can use less filler so that you have fewer complications down the road. Now, how much filler does somebody really need for facial rejuvenation? This is such a tough question to answer. A very basic rule is that if you've never had filler done before, you need about the same number of fillers as the decade of life you're in. So if you're 45 years old, you need 4 syringes of filler to start with. I don't personally stick to this rule. I am lucky where I work in a cosmetic practice where we have over 50 different devices. And so I am able to curate a regimen that combines tightening procedures, laser procedures, as well as fillers to give you the result that you want. But most people need multiple syringes of filler. And that's because 1 cc or 1 milliliter of filler is the volume of a blueberry, which is not a lot. If you're coming in and you need multiple, if you have volume loss everywhere, then I'm going to say you need a blueberry here, a blueberry there, a blueberry in your chin, a blueberry in your temple. And so sometimes multiple syringes of filler are needed. And this doesn't mean that you're going to look overdone. Well, it depends on the injector, but usually if you come and see me, you're not going to look overdone. My goal always is to make sure that you still look very natural. But what I like to do often is to set the foundation with hyaluronic acid fillers, and then I can use biostimulatory fillers as maintenance down the road. How is filler injected? There are 2 main ways a filler can be injected. One is via needle, and the other one is via cannula. A needle is sharp, and often I will use a needle when I want to place filler kind of deep as depots onto a bony surface. So for example, when we're doing filler in the chin, or if I'm doing filler in the cheeks, I will use a needle. I also use needle to inject filler into the lips. Now, all of this sounds kind of painful and it's not the most comfortable, but we often use various topical numbing methods to help alleviate the injection pain. The fillers themselves, most of them contain lidocaine, so as the injections continue, the lidocaine helps to numb the area. A cannula, on the other hand, is not sharp. It is a blunt, long needle. What we do is we first create a port of entry with a sharp needle, and then the cannula is inserted and product is kind of injected either in an anterograde or a retrograde fashion. I really like using cannulas as much as I can to help with facial volumization because cannulas have a lower risk of bruising and a lower risk of vascular occlusion, which I will definitely talk about later on in this video. However, one downside of cannula is that it's not as specific as needle injection, which makes sense, right? Because I can take a needle and inject it anywhere I want. Cannula is not as specific. So most injectors will use a combination of needle and cannulas to inject their filler. What is the downtime with filler injections? So as with any injection, there is a risk of bruising. And like I mentioned, we often will use a cannula to minimize the risk of bruising. Bruising takes about 2 to 3 weeks to resolve. There's also swelling where the filler is injected, which also takes about 2 to 3 weeks to settle down. And occasionally, if we're injecting filler onto the bone, you can get what's called a bone bruise. And this usually takes about 3 to 4 weeks to resolve, and it can be sometimes painful with movement or touching. But this is all temporary. It all goes away. The filler itself settles down, and within 3 weeks, the filler kind of integrates into the tissue, and it's usually 20 to 30% less than on the day of injection. What are the risks of fillers? The worst risk from filler is the risk of blindness. And I know that is scary, and it should be. So this is why it is so important that any injector really knows their anatomy. They know where blood vessels are, and that there could be variations in blood vessel anatomy that differs per patient. I am a skin cancer surgeon, and so for me, I think I know my anatomy really well. And that's why when I'm doing these filler injections, I emphasize anatomy so much, because if you don't know your anatomy, you cannot do cosmetics properly or surgeries properly. So the reason blindness can happen with filler is because when the filler is injected, it accidentally somehow gets into a blood vessel, and then through a retrograde flow, the filler then gets into the retinal artery. The retinal artery is what supplies oxygen and nutrients to your retina, which is where your vision comes from. So if that blood flow to the retina is occluded, that is how you can get blindness. So animal studies suggest once filler gets into the retinal artery, there's about 90 minutes before that blindness becomes permanent. So you have 90 minutes to reverse that occlusion before the blindness becomes permanent. The way you can reverse that occlusion is using an injection technique called retrobulbar injection of hyaluronidase. So hyaluronidase is the enzyme that dissolves hyaluronic acid. Retrobulbar means that you're injecting behind the eyeball to be able to get to the part of the retina and dissolve that filler. Does that sound hard? Yes, it is hard. Usually the people that can safely do retrobulbar injections are oculoplastic surgeons. Should the injector do it if they're not an oculoplastic surgeon? Probably not. That means me, I am not an oculoplastic surgeon. I'm probably going to call my oculoplastic colleagues to come dissolve this filler for me should this ever happen to me. Knock on wood, it never has, and hopefully never will. If you're not an oculoplastic surgeon, you probably shouldn't be doing retrobulbar injections, just in my humble opinion. And that's because the risk of piercing the eye globe is 1 in 12,000 with retrobulbar injections. When you're an injector and you're doing fillers, you have to take all of these risks into account, and most people don't. Overall, though, the risk of blindness with fillers is incredibly low. It's around 1 in 300,000, depending on which studies you look at. But that risk of blindness does go up if filler is injected into certain locations like the nose or the glabella. The glabella is the area in between your eyebrows. This is why I rarely fill the nose or the glabella. And this is why I also hate the term lunchtime nose job. How can we minimize the risks of fillers on the nose by calling it a lunchtime procedure? But unfortunately, social media isn't always accurate and doesn't always depict all of the things that go behind the before and after photos. In my practice, I will not do nose filler if the patient has had a previous nose job because this alters the anatomy of the blood vessels, and I don't feel comfortable taking that risk. So yes, blindness from fillers sounds really scary, but that risk is very low, and that risk is especially low if you see the right injector who knows their anatomy. So make sure you check the credentials of your injector before you go, and don't get a Groupon deal. The second worst risk of fillers is vascular occlusion. This is very similar to to what I described with occluding the flow of the retinal artery. A vascular occlusion happens when filler gets into a blood vessel and the blood flow to that part of the skin is occluded, thus causing skin death or called necrosis. Before the skin actually dies, so there are certain signs that the patient and the injector can notice, such as like a lacy-like distribution of bruising, blanching, numbness, or severe pain, and a delayed capillary flow. That means that when I press on the skin, it fills back much slower. If any of these signs are noticed, you can immediately inject hyaluronidase and just kind of flood the area with hyaluronidase to help dissolve the filler, plus do other things as needed. So actually, recently there was a TV reality star, Lily Galacci, who posted about her story and how she got vascular occlusion and all the steps needed to make sure that she didn't get necrosis. So she ended up being fine, but it kind of just shed light onto this particular risk of fillers that a lot of people don't talk about. Just like blindness, some areas of the face are at higher risk of vascular occlusion than others. There was actually a 2022 article that looked at all of the sites of vascular occlusion and put it on this chart. As you can see here, the nose is the most common site of vascular occlusion, is also the most common site of blindness. The second most common site for vascular occlusion is the nasolabial fold, but this is also the most common site of filler injection. So, because so many injections are done in the nasolabial fold, it makes sense that you're going to have a higher number of vascular events in this area. So it would have been interesting in this article to note what percentage of injections lead to necrosis, because that would have given us a better measure. But what we can deduce from this article is that the nose and the glabella, so the nose and the area in between your eyebrows, portend the highest risk of vascular occlusion and the highest risk of blindness, and they're also less commonly done procedures. And so if they have a higher rate of vascular occlusion, that means these are riskier areas. With that being said, there are certain injection techniques that are safer and that lower the risk of vascular occlusion. So for example, in the nasolabial fold, we'll often use a cannula to inject filler. On the nose, there are certain methods reported to be able to inject filler so that we inject very low volumes and keep the hand moving so that we don't get into the artery. What exactly is the risk of vascular occlusion? Well, a 2021 study states that in the hands of dermatologists, the rate of vascular occlusion is about 1 in 6,000 if a needle was used and 1 in 41,000 if cannulas were used. And in the hands of these 370 dermatologists studied, most of these occlusions resolved without any necrosis because they were able to recognize the signs early on, inject the hyaluronidase, and thus have no long-term sequelae. So that is the key, by the way. So occlusions, vascular occlusions can happen to any injector, but how to handle them, this is what differentiates a novice from an expert. In general, outside of this 2021 study, the risk of vascular occlusion is about 1 in 2,000 or 1 in 3,000, depending on which studies you're looking at. So the risk is lower in the hands of board-certified dermatologists who go through a lot of training. Now, in general, a vascular occlusion can happen with any filler, but it is most common when fat transfer is used or when fat is used as filler, followed by hyaluronic acid fillers, followed by radiance, and then less with Sculptra. If a vascular occlusion, though, does happen with radiance, there is no reversal agent, so you cannot dissolve radiance. And I will talk more about this in my upcoming video. A radiance occlusion, while it may occur less, it can sometimes be worse because we can't dissolve it. For this reason, I tend to prefer hyaluronic acid fillers over radiance on the face. The third issue with hyaluronic acid fillers is that they can cause swelling and distortion if overdone. And this is definitely very common as seen with celebrities. In fact, in the last 20 years, there is a new diagnosis called facial overfilled syndrome or overfilled facial syndrome or filler fatigue. And this is basically when the face becomes so overfilled that it starts looking like a balloon and the natural anatomy is distorted. Filler fatigue occurs because excessive amounts of fillers are put into the skin without dissolving any of it. So from a scientific perspective, the occurrence of facial overfilled syndrome occurs for multiple reasons. One, there's a volume mismatch. So for example, 10 years ago, a lot of patients were putting filler in the cheeks to give these big plumpy cheeks like Courtney Cox here. This caused a distortion of normal anatomy. And if you didn't know much about fillers, you might look at her after a photo and be like, there's something off about her face, but I don't know why. Something looks weird. And this is just volume distortion. The same thing with lips. A lot of lips are just being overfilled and they're walking into the room before the face does. And if the lips walk into the room before the face does, there's definitely a problem with distortion. The second reason for facial overfilled syndrome is just skin elasticity. So the skin is an elastic organ, and if you keep on putting filler into the tissue, it's going to stretch to accommodate that volume, to accommodate that filler. And if you consistently overfill, it's going to consistently overstretch the skin, which over time causes loss of elasticity and kind of sagging of the face. This contributes to the balloon faces you can often see in celebrities who've had way too much filler done. And the reason fillers were overdone in the last decade is because there was this misconception that fillers only last 6 months to 2 years. So every 6 months to every year, patients would come in to get their faces refilled because the desired effect was gone. But what we have found out is that fillers lose their desired effect in 6 months to 2 years, but they are still in the tissue. They're just in a different plane than where we want it to be. So when we kept on putting more filler, we kept on stretching all of these tissues. In fact, there was an MRI case study that showed filler in different planes of tissues, even 15 years after filler was placed. And I myself had an experience where I was doing skin cancer surgery on a patient's lip, and I do Mohs surgery, which means I look at the path underneath the microscope, and I saw all of this filler underneath the microscope. And when I asked her, she was like, "Oh, I got filler done 15 years ago." Well, 15 years later, that filler was underneath the muscle. It's usually injected on top of the muscle. So it had migrated to underneath the muscle. Before anybody asks, fillers and Botox do not cause skin cancer. But what I'm trying to make a point is that when we keep on layering filler on top of filler, the filler just kind of migrates to different tissue planes, eventually resulting in this overfilled facial syndrome. So now the question is, why are injectors overfilling the face? Why don't people just stop filling or use filler in moderation? And the reason I think this has been happening is because of two main reasons. One, any medical professional can use Botox or fillers without much training in cosmetic procedures or anatomy. These cosmetic procedures, unfortunately, are not highly regulated by the FDA or really any medical board. So I see a lot of non-dermatology, non-plastic surgeons, just physicians who trained in maybe OB-GYN or cardiology or anesthesiology, setting up medi-spas, taking a weekend course, and doing Botox and fillers. And they do this because they think cosmetics makes money, but cosmetics isn't their scope of practice. That's like me going to do orthopedic surgery because I think it makes money. I didn't train in orthopedic surgery. I don't know the anatomy of a knee replacement. And similarly, a non-dermatology, non-plastic surgeon doesn't understand the anatomy as much as a dermatologist who did their training within this arena. In order to be able to do Botox and filler, you don't even need an MD. You can really be any medical professional. So that includes RN, PA, MD, DO, dentists, or estheticians with a medical certificate. Once you have any medical degree of any kind, you can then just take a weekend course and set up shop to do Botox and fillers. So in fact, when I was preparing for this video, I was kind of looking through different training websites, and I found this one training website here where in 9.5 hours, you can learn how to do Botox, and in another 9.5 hours, you can learn how to do Botox. So in 19 hours, you can get the certificates to do Botox and fillers and set up shop, and thus every corner now has a medi-spa offering Groupon deals for these procedures. And while they do have supervising doctors, often these doctors are not on site. So if there's a complication, there possibly isn't anyone on site to help you with that complication. And sometimes these doctors, even if they are on site, they're not well versed in cosmetics because they are sometimes cardiologists or anesthesiologists, or really any MD or DO can supervise a medi-spa. So they don't even have to be trained in cosmetics to supervise. It's just incredibly sad that this is what has happened to the cosmetic world and that patients sometimes have no idea what they're getting themselves into. I always emphasize, fillers, lasers, Botox, yes, they are elective procedures, but they're also a medical procedure. It takes an immense amount of knowledge in anatomy and an aesthetic eye for how to bring harmony to the face in order to perform these procedures properly and correctly. So for me, I did an entire fellowship after undergoing dermatology residency in surgeries and in cosmetics. This fellowship is in addition to 4 years of residency that I did after 8 years of college and medical school. And even during my residency, I did cosmetic procedures under the supervision of an attending doctor. So I had to do so much training before I could start doing these procedures on my own. But I didn't have to. I could have just taken a 19-hour course and still been injecting Botox and fillers. So rant over, but the point is, don't sell your one and only face to Groupon. Check their credentials of your injector. Make sure that they themselves look normal, because that is how they will inject you. By the way, in my own clinic, I see so many overfilled faces and they want more filler. I say absolutely not. I want to dissolve all of your filler first, then improve your skin quality and sagging by doing various tightening procedures, and then we can talk about replacing the volume once we see what the skin looks like without being overstretched. So the first reason for the overfilled facial syndrome is because there's too many injectors who don't have enough training. The second reason is due to perception drift. Perception drift is my term for how our perception of beauty has drifted by looking at before and after photos on social media, by looking at these beauty filters that change the shape of our face and our lips, and by having influencers like the Kardashians who change their faces and their lips like the way they change their fashion. So this is a perception drift. What we used to consider unnatural is now considered beautiful, and we have to reverse this drift. So the best example of this, about 10 years ago, there was a beauty pageant in South Korea, and a photo of all the contestants was in a newspaper, and all of the contestants looked the same. And it caused an outrage in the West because these contestants got plastic surgery to fit the mold of what was considered beautiful in South Korea, and they all ended up looking the same. And this is exactly what's happening here. If you look at these Instagram pages, all of the lips look the same, the faces are starting to look the same. We're all losing sight of the facial features that make each ethnicity beautiful and diverse, and we're making everybody get high cheekbones, angular jawline, big fat lips. And that does not look good on everybody. So just remember, social media is not real. The before and after photos aren't always real either. And you really need to see somebody who will say no and still make you look like you. So now that I have scared you thoroughly about hyaluronic acid fillers, you're like, I am never going to get this done. Why would I ever get fillers done if this is what happens? This is not the approach to fillers. Yes, there's a risk of all of these things happening, but that's why I have this video so that you can be informed. But then you can also go find the injector who will give you fillers in moderation and still make you look good. So for example, I have Botox in my face, I have fillers in my face, and I think that I can still move my face and I look very normal, I hope. The main advantage of hyaluronic acid fillers that I've mentioned before is that they are flexible and reversible, but the other advantage is that the results are immediate. So you will see an immediate correction of volume loss when injected. And if you don't like it, I can dissolve it. So when done properly, hyaluronic acid fillers can really restore youth and vibrancy to the face. My approach to fillers, so whenever somebody comes to me and they want fillers, my goal is to evaluate your face and make sure that whatever we end up doing, the result is balanced and harmonious. That means that one part of the face flows to the next without disruption, without distortion. This doesn't mean that we try to chase symmetry. We are not symmetric, and that's okay. We don't want to chase symmetry. We want to make sure you're balanced. If you have a lot of skin sagging, I will recommend that you either get plastic surgery first, or if you don't want to do that, then that we do some skin tightening treatment so that we can improve the skin quality before injecting filler. And I even combine it with laser resurfacing if we need to improve skin quality, and with Botox if we need to improve some lines caused by muscle movement. My goal with hyaluronic acid fillers is to set a foundation first, followed by maintenance treatments if needed. I often use a combination of different filler types when I am doing facial volumization. So for example, I might use a hyaluronic acid filler to fill some of your cheeks. I might then use PRF or platelet-rich fibrin to fill the hollows under your eyes, followed by Sculptra for maintenance or getting rid of those nasolabial folds. Platelet-rich fibrin is one of my new favorite forms of filler. It's also called Easy Gel. It comes from your body. It is completely natural. It doesn't cause distortion, but adds volume in a very natural way. So what are the restrictions after filler, and what should you prepare for when you're getting fillers done? I usually tell my patients after they get their fillers done that I don't want you to massage any lumps or bumps. If you have lumps or bumps, let me know. I will massage it for you. And that's because I injected the filler into the area I wanted to stay, and I don't want you to massage it away. You can't exercise for about 24 hours after filler. Again, we don't want it to move. You also can't fly for 48 hours after filler, and that's because air pressure can theoretically cause the filler to move. Don't swim for 1 week. There are openings where the filler was injected, and we don't want you to get any infections. And honestly, get rid of magnifying mirrors, because as soon as people get fillers or Botox in, they start staring at their face and they find all of these other flaws, and it leads to a whole bunch of dysmorphic issues. So just get rid of your magnifying mirrors. After filler, you should expect bruising and swelling for 2 to 4 weeks, like I mentioned before, and it takes a few weeks for the filler to settle down and integrate into the tissues. Bruising can be minimized if you don't drink alcohol for 1 week, stop taking vitamins or fish oil for about 2 weeks prior to the procedure, and if you use arnica, which is over the counter, arnica helps a lot with bruising, so you can use it topically over the areas of bruising. Sometimes if patients get fillers done and they have an event to go to, then I can bring you back 2-3 days later. I can laser that bruise and it makes it go away much faster. Injection filler can also be uncomfortable during the procedure. We are injecting needles into the skin and different depths, and so there can be some level of pain and discomfort. Like I said, we use topical numbing. There is lidocaine often in the filler itself, so as we inject, it numbs. For lip fillers, I actually do what's called dental blocks, meaning I will inject numbing so that it numbs this lower area. That way I can inject filler much more easily. I also often use a vibrating device, which kind of distracts you from the pain. So we use different techniques to help make the procedure much more comfortable. Now, finally, the part of the video where everybody likes, let's review some fun cases and befores and afters. So this patient, she has a small, thin face, but she has very good skin quality, and she does have appreciable signs of volume loss and a little bit of skin sagging. So I injected about 5 syringes of filler. Sounds like a lot, but it's not a lot, and I spread those 5 syringes across 2 sessions. The first session also included Botox, which I like to combine with filler, but the filler was in her mid cheeks and lateral cheeks in the first session, and the second session included filler in her nasolabial folds and her chin and her pre-jowl sulcus. So we basically, her face was a little square shaped in the before, and now it's a little bit more upward triangular vector in the after photo. She would also benefit from some filler in her temples to reduce some of that hollowness and restore more balance to her face. But overall, you can see that her face still looks natural. If you just saw the after photo, you wouldn't even know that anything was done. Here's another example where the patient wanted lip filler. She has thin lips and she wanted to be able to put lipstick on without the lipstick going on the surrounding tissue. When I saw her, she had some volume loss in her chin and her lower face needed a little bit more support. And so we ended up doing filler in her chin shadows, which are these shadows here, as well as in her lips. Her lips still look like they are her lips, but they're just a little bit more volumized so that her lipstick goes on better. And she had a little bit of a frown situation, which got turned upside down with the filler that we did. Here's another case of a lower face filler. She also wanted lips. Everybody just wants lips. And honestly, if you get lips done, you also need the surrounding tissues to be supported, because otherwise it looks abnormal. So in this patient's case, I filled her nasolabial folds with hyaluronic acid filler, as well as the corners of her lips and a little bit in her chin, so that we can add support. I only did about 0.5 cc, so only about half a syringe of filler in her lips. She just wanted them a little bit more plump, but she didn't want to change the shape too much. So that is what I have for hyaluronic acid fillers. Yes, there are risks like there are to every single procedure, but when done properly, it can result in a very beautiful augmentation of the face. It's an immediate result, and usually patients are so happy. So don't be afraid of fillers. Just go see the right injector. It is not the filler that's the problem. It is the injector that's the problem. Subscribe for part 3, where I talk about biostimulatory fillers like Sculptra and Radiance. And I actually perform biostimulatory fillers probably more than I do hyaluronic acid fillers in my office. If you want to learn more about PRF or platelet-rich fibrin, which is a natural filler I talked about earlier in my video, then you have to check out this video. PRF is a new type of natural filler that has now become my favorite and something that I now commonly do in my practice. It is completely natural, made from your body, so check out that video, and thank you for watching this one.